I think the Caring for Colorado Foundation never ever shies away from solving the hard problems. When there is an issue or a gap or a need identified, Caring for Colorado drives at really understanding what the issue is so that it can effectively bring the right stakeholders together to solve that problem.
Oral health cripples kids. It's the most common reason that kids miss school, far and away. 5 times more common than asthma. These kids were forgotten until Caring for Colorado came along. We have improved the oral health of children in this state. They're better off today than they were a decade ago because of Caring for Colorado.
Caring for Colorado is dedicated to the notion that healthcare should be accessible anywhere in Colorado, starting with the organization's structure. I mean, there are rural board members, there are people who understand the vast geographic areas of our state. So from a systemic perspective, there's an understanding of what really needs to happen.
I think one of the things that Caring for Colorado has been able to do in terms of relationships with funders is really look at the relationship as though it were a partnership. So many times we're tempted to say, well, we have the money and we may give it to you and we may not, instead of saying, who are you, what do you need, what can we give you, how do we fit together? So I think the partnerships and the long-term relationships are really part of the hallmark of good funding.
So some of the great values that really are exemplified by the Caring for Colorado staff and foundation really are shown by some of the work that they've done in different areas of mental health, dentistry, oral care, as well as really building the foundation for some of these organizations who are critical to providing care in Colorado. I think that's something really unique to the Caring for Colorado Foundation and a tribute to the staff who are exemplifying those values on a daily basis.
There was never a time where we didn't discuss how do we best serve all areas of Colorado. And that's why I really loved it, because oftentimes we think if it's located in Denver, it's just serving Denver. And that wasn't the case with Caring for Colorado. And really reaching out to rural areas and making a difference from Sterling to Durango to Grand Junction to Pueblo. And so being around those folks and really experiencing the intelligence of the staff and the board and just their compassion for the whole state was really an amazing experience.
And so our viewpoint is that the better the well-being and health is of any community, actually the better it is for all of us. It sort of has a ripple effect. And I would say Caring for Colorado has not been a tiny pebble in the pond, it's been a big rock. And that ripple effect is going all across Colorado.
15 years and $100 million doesn't seem like very much, but we know it's important to stay the course and to continue with the priorities we have. We've got a good strategic plan in place. The board and the staff, I think, will work well together to continue to implement our priorities. And we see that we're going to continue right down that path, and really we've got a long-term view of what needs to be done and how we can help get it done.